The mayor of New York City inspects an emergency warehouse and a delivery of 400 ventilators. It's a start, but in the city where infections are doubling every 3 days, they'll need at least 30,000, they say, to cope with the expected influx.
This is life and death. This is not, sometimes people use words that are too dramatic. This is not too dramatic. This is the blunt truth. It's life and death.
If New York State is the epicenter of the pandemic in America, then New York City is the epicenter's epicenter. 16,000 cases in Manhattan alone and nearly 200 deaths, and the worst is yet to come. You might not know it to look at Central Park with joggers and cyclists out in force. The state's governor said today he'd open up the streets to pedestrians to force them to spread out and slow the rate of infection and hospitalizations. But the most pressing issue of all is this.
Ventilators, ventilators, ventilators.
Car makers like Ford and General Motors have stepped in to help ramp up supply, but have warned that because of the late start, they won't deliver new equipment until June.
To get ventilators and these business consortiums put together, supply chain, design team, ramped up and delivered a 30,000 ventilators is an extraordinarily difficult task.
In Los Angeles, they've set up an emergency blood donation center. Places like this were initially shut down to reduce the risk of spreading the disease, but now a severe blood shortage means they've had to reopen.
It can feel tough to feel cramped inside maybe, or feel like you're not able to contribute. This is definitely a way to do it.
And a massive shortage of masks across California led these women to shut down their clothes workshop and make medical masks instead.
This is a small thing that we can do, and I think everybody feels the same way I do. Let's do it.
California is another hotspot, but across America, the rate of growth is accelerating and likely underreported. Some predictions have cases reaching 250,000 within 2 weeks, with the death toll potentially breaching 10,000 by Easter.
Easter is our timeline. What a great timeline that would be.
Just when Donald Trump envisages packed churches and businesses raring to go.
I just thought it was a beautiful time. It would be a beautiful time, a beautiful timeline. We were thinking in terms of sooner. I'd love to see it come even sooner, but I just think it would be a beautiful timeline.
His top infectious disease advisor looked awkwardly on, and when asked if he approved of the plan, concluded,
you can look at a date, but you've got to be very flexible and on a literally day-by-day and week-by-week basis.
Others were less subtle.
It seems very fast to me, probably dangerously fast. We still don't know exactly how far this disease has spread. We don't really know the number of cases. Testing has been so woefully inadequate that we have only a very thin grasp on the state of the disease on the ground.
If that's anything to go by, it seems crazy that he's more worried about getting Wall Street down the road back up and running.
He's being advised to do it by business people who he often trusts more than economists. But almost, to an economist, they're saying this is incredibly risky. The cost to the economy of trying to engage in normal business will be huge because the public health risks are so great.
His business friends on Wall Street were certainly happy today. Shares soared as the Senate finally passed a $2 trillion package for stricken businesses like airlines and workers struggling to make ends meet. But even before the ink was dry on the bill, there were those who said the next one would need to be even bigger.
Siobhan Kennedy there. Well, joining me now from New York is special pathogens expert, Dr. Saira Madad. Dr. Madad, thanks very much for joining us. Just tell us from your perspective, what is the situation in New York City right now?
Well, as you know, New York City and New York State is one of the epicenters for coronavirus disease in the United States, over 30,000 cases and counting. So certainly a very large caseload, and it's only going to increase. We're still very early on in this current epidemic that we're facing here across the state. We know there's going to be many more cases to come in the pipeline. So we are making sure people understand what it means to do social distancing, because there's only two options here. Either we overwhelm the healthcare system or we do long-term social distancing. And quite honestly, if we overwhelm the healthcare system, everybody knows the outcome. There's going to be a lot more morbidity and a lot more mortality. So people obviously just need to understand that everyone has a role to play, and we need to make sure that we're not creating new chains of transmission, and we're reducing the number of cases so that way we can keep up with the volume.
I mean, Governor Andrew Cuomo has sounded increasingly desperate in his plea for federal government to give him more medical supplies. Can the health system cope, do you think? Will it be able to?
Well, it's just one of those things, time will tell. I mean, there's forecasts being thrown out there from a state standpoint, obviously even across the nation. The numbers look very daunting in terms of what to potentially expect at the peak of this current epidemic. A lot more supplies need to be put into place, more staffing, a lot more beds. As you know, we're obviously not in this alone. There's obviously states across the nation in the same boat, but everyone's working together in a collaborative format. The governor has done an amazing job being a leader and speaking with one voice, providing the facts and the truth and what we need and what we don't have. And so it's just one of those things. Everyone's working around the clock and making sure that we have the needed resources.
But there is an issue, and many people would say we've seen it here too, of mixed messaging. Governor Cuomo has been very direct, talking about the virus ripping through the state like a bullet train. But you have President Trump saying only yesterday that he was hoping the US would be up and running for business by Easter, a great American resurrection. I'm just wondering, from a medical standpoint, how dangerous do you regard that mixed messaging?
Well, this is obviously an outbreak, and we're in it for the long run. So this isn't obviously, as I mentioned, in other types of forums. It's not a light switch that you can turn on and off and think in 2 weeks this outbreak is going to be over. We need to make sure that we can continue to reassess every couple of weeks, every couple of days. But we're not going to obviously just be done and wash our hands with obviously this outbreak. This is something of a significant issue across the world, not just here in the United States. And we need to make sure that we're putting in our all, because obviously if you start opening up the economy, if you start opening up, and loosening social distancing, you're going to see a lot more cases and a lot more death. And so, you need to make sure that we're looking at it from a public health standpoint and not from just an economic standpoint.
Do you get the sense that people on the ground across the country get the seriousness of it, that they are beginning to socially distance, they are beginning to stay at home?
So, all the response at the local level is different across the nation. And certainly I can speak for here at the state of New York, a lot of leaders from the scientific community and even politicians speaking with one voice, making sure people understand what it means to do social distancing. And even across the nation, a lot of elected officials have been obviously harping on the same message. It is up to the individual person to make sure that they're abiding by it. And so there's a lot of messaging going out in terms of no one is invincible. This virus can infect everybody, even the healthy, even those that are obviously the elderly, those that have comorbidities. As you can see, in the United States, a large portion of individuals that are actually in the ICU, that are actually hospitalized, are not even in that high-risk category. They're not even over the age of 50 or have comorbidities. These are healthy individuals that are young, but they're still ending up in the ICU for a long stay. So, again, making sure that people understand everybody has a role to play and anyone can get infected.
Dr. Saira Madad, thank you very much talking to us there from New York. Now, coronavirus has now claimed 16,000 lives across 195 countries. And the United Nations says individual countries can't respond alone, calling for the world's richest nations to provide $2 billion to help the world's poorest survive. In Italy, another 685 people died in 24 hours, while in Spain, more than 3,400 people have now died in the outbreak. Here's our Foreign Affairs correspondent, Jonathan Rugman.
This is what a health system looks like when it's overwhelmed. A hospital outside Madrid overflowing with coronavirus patients. On the day, Spain's death toll overtook China's, the infection rate here doubling in 3 days. The staff are frightened of taking the virus home to their families, yet they're working extra shifts because so many colleagues are also off sick. Spain is now appealing to NATO for medical supplies, including testing kits. And listen to the controlled rage of this emergency doctor.
I don't want to get involved in politics right now, but when I hear on TV there is sufficient equipment, I can't believe it. When the famous crisis committee says we have everything, it isn't true. When they say we have 300,000 testing kits, well, that's very nice, but those kits must be tested by professionals. And when they say we have 300,000 kits every day, I can tell you that isn't true.
Hearses and ambulances are taking the dead to an ice rink in Madrid for cold storage. First, their families were forbidden from visiting them in hospital. Now their loved ones end up here, after state morgues said they had run out of space and protective clothing. In northern Italy, the army has been ordered to take coffins from churches for cremation. Italy's death toll at over 7,000 is the world's highest, and though there are signs the daily rate is slowing, that cannot happen fast enough. In a poor housing estate in Naples, the police are now using drones with cameras to monitor the nationwide lockdown. Fines for violating it have been increased, ranging from €400 to 3,000. In China's Hubei province, where this pandemic began, construction workers returned to building sites after 2 months of restrictions began to lift. And this supermarket reopened in the city of Wuhan, though the vast majority are still wearing face masks, while shoppers had to display health codes on their phones, proving they had not been in high-risk areas before they were admitted inside. With China beginning to bounce back, it is India where perhaps the greatest fear lies. This is the world's biggest lockdown. 1.3 billion people indoors for the next 3 weeks, though with the official death toll standing at 10 so far.
People who are fit and normal and make money like me will earn a living and get by, but others who are dependent on their daily wage for their daily bread, how will they get by? The government should look into their situation.
In the northern town of Batla, a policeman ordered his fellow Indians to cover up their faces and to apologise for breaking the curfew, forcing them to lie or to squat on the ground. And officials believe that only a complete shutdown will avert disaster.